Good day, class. In this video, we are going to study the premenstrual syndrome. The premenstrual syndrome, PMS, refers to the combination of symptoms that patients experience about 1 week or 2 before their period. From the definition, we will know that these symptoms must accompany with the period. So it happens with the routine onset. The patient will experience every single period. The patient will experience before every single period. The patient will experience before every single menstruation, and it repeats in the next cycle. So that's how we diagnose premenstrual syndrome. These symptoms must accompany. These symptoms must relate to the menstruation. Different symptoms may present in different patients, such as bloating, headaches, moodiness, or breast distension, diarrhea. The breast distension is very common, and in most situations, the patient will start to experience this syndrome, PMS, about 2 to 7 days before their period. The patient may present as one symptom only or the combination of different symptoms. According to the characteristics of female reproductive system, the PMS mainly related to the liver, the Qi and Ren meridian, Qi and blood circulation, and the uterus. The uterus is one of the extraordinary organs in the basic theory. The reason is because the function of the uterus is very different from both the Zang organs and Fu organs. During a menstruation cycle, the uterus changes its function from storing to discharging. So during the cycle, before the period, it's the storing function, but during the period, it becomes discharging. But in this process, from storing to discharging, the Qi and blood flow increase. In this situation, if this patient suffers from Qi stagnation, in general, the patient suffers from Qi stagnation before the period, because of the enhanced or the increased volume of Qi and blood, then the patient will present as more severe Qi stagnation. That's why the patient may present as bloating, headache, or breast distension. So what kinds of symptoms the patient will present? It will depend on individuals. For example, if a patient suffers from yin deficiency, blood deficiency, and in this situation, during the period, the patient may present as headache, dizziness. The patient presents as spleen deficiency, kidney deficiency, Qi and blood deficiency. During the period, they are more likely to suffer from diarrhea. Although this syndrome may relate to many meridians and organs, this syndrome is very closely related to the liver, and the most common situation is the liver stagnation. For example, this patient, in their personality, is more depressed or anxiety. During the period, it will result in blood deficiency, in the liver, the malnourishment of the liver. Because of the liver meridian distributes through the breast, So it may result in a breast distension. The liver stagnation may result in internal heat. Internal heat, the fire may travel upwards, have the characteristic of moving upwards the flames. So the patient may present as headaches due to liver qi stagnation, but this qi stagnation must result in liver fire. If there's no liver fire, then this qi stagnation, the patient also may present a headache or bloating, even breast distension. But this is like distending sensation. It also can change the mood of the patient. That's because of the liver fire can affect the heart. So the heart function houses the mind. The liver fire also may result in bleeding, especially in the upper part of the body, such as nose bleeding or vomiting blood. The liver stagnation. The liver may affect the stomach. The liver may affect the spleen. That's from the theory, the wood and the earth. It may result in diarrhea. Once the spleen function has been affected, it may result in edema. So you see, all these symptoms may have the similar root cause of liver. So apart from these symptoms that we mentioned on the slides, the patient also may present as nose bleeding or vomiting blood, edema. In the treatment of this problem, we need to combine the nature, the property of the period, such as the color of the period, the volume of the period, and also take into consideration of the tongue and pulse. In the treatment principles, we mostly focus on the liver, the spleen, and kidney. The treatment also needs to focus on the qi and blood. But most importantly, in all these organs, we need to focus on the liver. The treatment for this problem, it depends on the time when the patient comes to you. So before, for example, if the patient comes to you 1 week before their period, they already experience all these discomforts. Then you can focus on the specific symptoms. You need to relieve the symptoms. So we also can start to treat this disease 1 week before their period. And after the period, we need to focus on the root causes to regulate the 脏腑 organs, the functions of 脏腑 organs. So this can help to prevent it happens again. Firstly, we are going to introduce the syndrome differentiation in general for all type of PMS, all type of symptoms, and then afterwards, I'm going to introduce each symptom, the most common symptoms. So the main symptom of PMS: bloating, headaches, moodiness, breast distension, diarrhea, edema, and bleeding. It can be one or a few, the combination of a few. It may be due to qi and blood deficiency, palpitation due to the heart, short of breath, the heart and the lung, poor sleep, the heart, dream disturbed sleep, the heart. Fatigue because of qi deficiency, scanty light red clear menstrual blood. That's because of blood deficiency. Deficiency means you lack of. That's why the patient presents as scanty. Light red, that's yang deficiency, qi deficiency. Pale tongue, qi deficiency, sun coating. A weak pulse. Liver and kidney insufficiency. Breast distension, weakness in waist and knees. dry eyes and mouth. These are so liver, related to liver, related to kidney, dry manifestations related to insufficiency. Insufficiency, the typical symptoms: very rigid sensations in the palms and soles, red tongue with scanty saliva, a thin rapid pulse due to heat, rapid pulse, thin, rapid. Insufficiency, you don't have a lot of fluid in the vessels, that's why thin. Phlegm, the patient may present a dizziness because the phlegm obstructs the flow of qi and blood circulation, a heaviness sensation, chest tightness or oppressive chest, abdominal distension, perfumed white sticky leukorrhea, scanty light red menstruation blood. Sometimes students will confuse why scanty here. The reason is because of the phlegm obstructs the meridian or the flow of the blood. And all these sensations, the heaviness and sensation in the head, chest tightness, or abdominal distension, these don't have to be in all in one patient because it depends on where the phlegm is. For instance, if the phlegm is in the head, in the upper part of the body, the patient will present as heavy sensation in the head. The phlegm also sometimes can be dampness. So dampness and phlegm, from the theory, we can distinguish clearly, but in the practice, in our clinical practice, in the most situation, it will combine together. So that's why the patient still have the heaviness sensation in the head. In 黄帝内经, it describes the sensation. What kinds of sensation what kinds of feeling is considered as a heavy sensation in the head? In 黄帝内经, it describes that it feels like you use a wet cloth or a wet towel you cover around your head. A wet towel to cover your head. That kind of sensation. Heavy sensation in the head. So if you want to experience, go to your bathroom, use the towel, soak in the water, put in your head, tie around your head, over the head, and then you can feel what kind of sensation is a heavy sensation. In our study, I always ask students to experience physically, although sometimes it may, especially in the practicals, some students may feel that it's very obvious. I can just observe, I can just think from imagination, rather experience the sensation physically. For example, take the patient's pulse, observe the patient's facial complexion. The more practice you do, the better you will be. So for some sensations, because you won't be able to experience all these symptoms, but some you can actually help yourself to feel what kinds of sensation the patient may experience. Chest tightness, if the phlegm is in the chest. If the phlegm is in the abdomen, it will present as abdominal distension. So these symptoms doesn't have to be all in one. A swollen pale tongue, because of the phlegm and dampness will result in spleen deficiency. Or in other way, I actually need to say in other way, the phlegm is the manifestation. The root cause of the phlegm is spleen deficiency. That's why the patient will present as a swollen, pale tongue with thick, greasy coating. The greasy coating is the phlegm. Slippery pulse, also the phlegm. And then qi stagnation and blood stasis. These two are very common. distending sensation in the breast, chest, and hypochondriac regions. Because these areas are where the liver meridian distributes. So it can be the patient may present as the distending sensation in these areas, purple color of the menstruation, or dark red of the menstrual blood, the clots. Some patients also may present as painful menstruation, purple tongue with spots, deep wiry phosphor pulse. Why phosphor pulse? That's because the qi stagnation may result in internal heat, so that's fire. It results in phosphor pulse. The treatment principles. The qi and blood deficiency, you're going to tonify qi and blood, use combination of acupuncture and Moxibustion with a reinforcing technique. Liver and kidney yin deficiency, tonify liver and kidney yin. Phlegm, clear the phlegm, such as spleen, such as stomach 40. Qi stagnation and blood stasis, activating qi and blood, such as liver 3, large intestine 4. The main points that you can think about is heart 7, U20, liver 3, spleen 6. And now you can select other points according to the symptoms. So I'm not going to go through this in details because we have discussed quite a few times for all these, the combination of these points. And then for specific symptoms, such as the breast distension, you can treat this patient. However, when you see this patient, especially in a lady in their 40s or 50s, if they still have this problem, apart from the treatments, you also need to differentiate with other diseases or other possible diseases. For instance, no matter what age the patient is, you need to differentiate with the hyperplasia of mammary glands. For hyperplasia mammary glands, mostly in palpation, you may find a knot in one breast, in one side, not both sides, and the distension, the breast distension due to PMS, due to premenstrual syndrome. This distension sensation will happen according to the menstruation cycle. It happens every single time, a few days before the period. So there's some symptoms or some signs you can help you to identify. If this patient presents as breast distension for the entire month, then you need to think about, is this a PMS or other diseases? For a lady that's in their 40s or 50s, if they still present as this problem, apart from the treatments, you also need to exclude the breast cancer. For breast cancer, sometimes the patient also may present as the distending sensation. However, this sensation doesn't have to have the routine onsets according to the menstrual cycles. For cancers, you also can palpate, you can find the physical knots. The patient may present as pain. In some situations, you also can see physically the changes of the breast. such as bleeding, or the skin of the breast becomes similar to the orange peels. So that's another sign of breast cancer. In this situation, you need to send the patient to have further examinations. For breast distension, you can think about the liver qi stagnation, liver and kidney insufficiency. For headache and dizziness, we are not going to discuss in details. You can compare the treatments in the specific discussion of headache and dizziness. Although this happens before the period, you also can use the theory in the headache and dizziness to help you to treat this problem. But in terms of the headache, the PMS presents with headache. The most common symptoms will be liver fire, blood stasis, and blood deficiency, because these are more related to the liver and qi and blood. So mostly the liver and blood, but the blood and liver, they're also in very close relationship because the liver stores the blood. Another common symptom is the common cold. Common colds in this period, the patient will present as the symptoms similar to common cold, such as sneezing, runny nose, headache, nasal obstruction, just before or after the period. So this is also considered as PMS. The treatments, you also can refer to the notes due to the common cold, such as wind cold or wind heat. But all these symptoms, all these different manifestations, you must differentiate from the common cold or PMS. Very importantly, the PMS, no matter what kinds of symptoms, it must have the routine onset, especially if more than 2 months. After a few weeks, the patient starts again. And once they start after a few days, the period comes, and the next cycle starts again. So especially after 2 cycles, then you can consider PMS. Some patients also may present as fever. Fever may mostly due to liver and kidney insufficiency, blood and qi deficiency, or some excess heat. So all these different symptoms, you may find evidence from. So for all these symptoms, you may find evidence from different symptoms and signs according to your 4 diagnostic method. Another common situation is the body ache. Patients also may present as body ache. This body ache also due to the qi and blood deficiency. Whenever there's a pain, there's a blockage. So for all type of pain, either blockage or malnourishment, lack of nutrition, lack of qi and blood. So for body ache, the most common symptom, such as blood deficiency or blood stasis. The mouth ulcers. Some patients also may present as mouth ulcers before their period. This may due to insufficiency with deficiency fire or stomach heat or stomach fire. The last 2 will be diarrhea and edema. The diarrhea may due to spleen deficiency or kidney deficiency. The kidney deficiency, if diarrhea due to kidney deficiency, the patient may present as diarrhea at dawn in the early morning. The spleen deficiency we have explained at the beginning of this video is due to the liver, the relationship between the liver and spleen. The liver may affect the spleen, so this may result in diarrhea. The spleen deficiency, such as loose stool, perfuse menstrual blood, pale color, distending sensation in the edema, fatigue, pale tongue, white coating. The last common symptom is edema. The patient may present as edema before the period or during the period. And this situation, the most common syndrome will be spleen and kidney yang deficiency and qi, stagnation and blood stasis. So although we introduce all these in general with the prescriptions above, but in actual clinical practice, you can identify in different diseases with different symptoms. You can think about all these different symptoms, and you also can refer to the treatments in specific discussion, such as the edema. We have introduced edema in previous slides. If the patient presents as edema during a period, which is considered as PMS syndrome, then you can refer to the treatments in the edema. No matter what type of PMS, what kinds of symptoms that the patient will have, we always need to differentiate with other diseases, such as the edema. We need to identify, is it the edema due to the heart problem, the kidney problem, or the liver problem in terms of the conventional medicine. This will help you to significantly reduce the wrong diagnosis. This also can have a safer practice. Edema also may due to malnourishment, may due to malnutrition. In some situations, some patients suffer from hypothyroid function, also may present as edema, but these patients will present as other many symptoms related to hypothyroid function, such as irregular menstruation, gaining weight, poor appetite, fatigue. For diarrhea, that's due to PMS. You also need to differentiate with the diarrhea due to improper food intake, or the diarrhea due to common cold or flu. For the body ache, you need to differentiate with the B syndrome. So the B syndrome we have introduced at the beginning of our study. B syndrome mostly related to the joints, and the body ache mostly related to the muscles. So that's the differences. The treatment should start 3 to 5 days before the menstruation. In this video, we mainly discuss the PMS. PMS may present as different symptoms. We in Chinese medicine, we actually consider as different diseases, such as the distending sensation in the breast, headaches, common cold, fever, mouth ulcers, diarrhea, edema, nose bleeding, or the moodiness, the change of the mood. So these are different diseases that's related to PMS. One of the most typical and important characteristic of all these diseases, The onset of these diseases must be related to the menstrual cycles. In other words, these diseases also may happen in other situations, such as we also discussed headache in general, the fever in general, diarrhea, edema in general. If you want to diagnose that this problem is due to PMS, this patient suffers from headache due to PMS, or suffer from diarrhea due to PMS, you must find evidence that the problem is very closely related to the period, and it happens at least 2 cycles every time before the menstruation. If you want to diagnose headache or fever due to PMS, you must find evidence to support your diagnosis. One of the most important evidence is the routine onset of this problem. It's very closely related to the period. When we said routine onset very closely related to the period, which means at least you need to see for 2 cycles, because if only 1 cycle, you won't be able to see the routine onset. So at least 2 cycles this month before the period, the patient suffers from edema or diarrhea. Next month, similar days before the period, the patient still have similar problem. Only in this situation, you may diagnose as PMS. Okay. For each diseases, for the study, the definition, the diagnosis, it is also very important to think about the differential diagnosis. Thank you for your attention.